question number 2. Let's talk about pain. So why do you have pain? Very common question. So let me talk about exactly what happens in your gut, or when we talk about pain, it's very important for me to know the location of that pain. And so I'm gonna kind of go around your gut. So your gut is like one little picture frame right here. This is where your gut is. It starts off here on this right side in the cecum. From the cecum, it goes all the way across to the ascending colon, goes across the transverse, descending colon, and into the sigmoid area. So let's talk about the areas in your body that can help explain what's going on with pain. So your sigmoid colon, which is right here, right in your bottom left-hand corner, right there. That's a very common issue for pain. People have diverticulitis, can have pain in that area. That's when you have pockets of your colon that are outpouching. Sometimes something can get in those pockets, cause inflammation to occur. You'll have pain, you'll have fever, and that can be a very significant cause for pain. That sigmoid area, the left lower area, also is an area where you can have a lot of movement or twisting around the colon. So if you're constipated, that could be a very common area where having pain, because it takes longer for your stuff to get through those twists that are there. If we go further up right here, up in this top left area right here, this is your spleen. This is not a common location to have pain. However, you do have a tight turn here, and this tight turn can be a reason why you're having pain as things are going through. Sometimes things can slow down and maybe not go through all the way, and that turn can make it more difficult for pain to occur. Up across right here, you have what's called the transverse colon. So right here is still part of your colon, but this is also an area where your small intestine is and where your stomach is as well. And sometimes people have pain up here. It could be colon pain, so it could be constipation. It could be stomach pain, maybe an ulcer, or maybe it could be gas from your small intestine as well. And this could be an area where we can have pain, but also in this middle area right here is where the pancreas lies. And so your pain can be right here. Also, if you have gallbladder issues, which is typically on this right side, sometimes the pain can be right here as well in the middle, and that may be hard to figure out. Now, if we go across top right side right here, so top right here is where your gallbladder is at. And if you have pain on that right side with your gallbladder, typically will be pain after eating, especially after you eat a heavy meal. Also on this left side, you have your liver. So contrary to popular belief, your liver typically does not cause a lot of pain. And so I know a lot of people tell me they have pain on their liver, but for most people, the liver does not cause pain, or it's a very overestimated cause for pain that could be there. But also in this area, you have another turn in your colon, and that could be a very common reason why people can have pain, having trouble with constipation. That stool can get caught up in that turn and make that pain occur there as well. Also in this area, you have your bile duct. So if you have a gallstone, and your stomach and your small intestine lie in this area as well. As you're going down here as well, this bottom right half right here, this is the connection of where your colon meets your small intestine. So sometimes patients who have Crohn's disease can have pain there. That's also where your appendix is at as well, but that appendix pain will radiate to your belly button. That's typically how we know what's going on there. So when it comes to pain, I try to localize exactly where it's at. If it's on the bottom left-hand side, I'm thinking somewhere in the sigmoid colon. If it's up here, maybe it's your gallbladder, maybe it's your stomach, maybe it's your colon. If it's your right lower side, it could be the connection between your small intestine and your colon as well. And so that allows me to help figure out what's going on based on location. Now, based on that, we can further classify: is your pain related to eating? Is it related to pooping? Does certain foods make it better or worse? Does taking a deep breath in make it worse? Does movement make it worse? These are things that I use in my clinical judgment to allow me to determine if this could be a cause for pain or not. And so that's kind of a doctor's approach to dealing with pain. I can tell you, pain is such a difficult thing for us to know exactly what's going on, because it can be due to a lot of different reasons. It may be constipation. It could be an ulcer. It could be gallbladder issues. It could be nothing. And so there are different tests that we use, whether it's a CAT scan, an ultrasound, blood testing, maybe taking a look with a scope. And all of these tests are complementary to allow me to fully paint the picture of what is going on when it comes to pain.